All right, let's do this. A lot of students ask me, how am I able to use disease condition and body system affected to answer any question that have to do with physiological adaptation, also known as your medical, surgical, or acute condition, chronic condition. A lot of students ask me this, right? Because on my program, I just do this simple thing and I'm able to answer the question. Now, I want to reframe the way you think. So follow me. Now, all what I just do is to know the disease condition. It could even be a condition. It could just be a condition. I'm just going to know the condition and I'm going to link it to the body system affected. It's all have to do with practice, because the first thing I practiced before while preparing for the NCLEX exam, right, was the body system, right? I learned the 10 body system, how they work, when they are affected, what sign and symptom do they display. Do you understand? So I learned everything. So when I knew all this about the body system, automatically I knew the sign and symptom for any disease condition. Now, if you tell me a patient has asthma, I know they are going to have respiratory, it's a respiratory condition. They are definitely going to have decrease or increase heart rate. It depends. If they are deteriorating, decrease heart rate. If they are struggling to for oxygen, increase heart rate. They can have low oxygen, right? We expect to see cyanosis, right? Difficulty breathing, all these kind of things, right? I don't need to start thinking about asthma. I'm only thinking about what will the patient experience from having a respiratory condition. Now, same for COPD, same thing. I don't need to be looking for differences between asthma and COPD. Automatically, I know that a patient with COPD will also experience respiratory problem, respiratory rate problem, oxygen problem. So do I need to now start reading 20, 30 respiratory conditions before I need to now master the sign and symptom that will be experienced by this disease condition? No, that will be a waste of time when I can just learn just one body system and I know 70% of what a patient that is having respiratory illness is going to experience. Does that make sense? This is a reframing. So instead of going to go study 30 disease conditions related to the respiratory system, go and learn the common symptom a patient with any respiratory condition will display, right? And then instead of learning 30 diseases, instead I prefer you learn 30 sign and symptom they will display. It's better that way, but you don't need up to 30, right? So now, but that's the whole story for another day. Now, you know this. Now, let us answer this question right here. Look at what the patient is experiencing. The nurse is caring for a client who sustained a closed-head what? Injury. Now, I'm not thinking about closed-head injury because nursing students automatically start thinking about closed-head injury. You understand? They start thinking about it. Oh, what will a patient with closed-head injury experience? Or that kind of thing, right? Cause you to be confused. You bring a lot of questions to your mind. So now you have this question to deal with. Now you are also answering other questions in your mindset. But I don't do all that. I only have this question, right? And I'm focusing on this question. The only thing I'm going to just ask myself is closed-head injury. What body system is affected? Guess what? The body system that is affected is the neurological system. Now, I want my patient to show sign of neurological system. Now, let's go through the options together. Now, option one, we are going to come to the stem very soon. But now, look at option one. They said blood pressure of 136/76. Is that a neurological symptom? No, that is not a neurological symptom. Guess what? If you are the kind of person that you think about the condition, right, you might say that, oh, this symptom is can be related to what the patient is experiencing, right, or the condition. But I'm not thinking about the condition, right? I'm thinking about the body system. A patient with neurological problem will not experience this. Neurological problem is restlessness, agitation, confusion. Those are neurological. Those are when you, okay, what would make you know a patient is having neurological problem? These are it, right? If someone tell you a patient have increased blood pressure, what are you thinking about? Cardiovascular system. Makes sense, right? Now, the next one, so I'm going to keep that because that is outside the, what are they calling it, the neurological system, because I'm expecting to see a neurological symptom, but instead I'm seeing what are they calling it, a cardiovascular problem. So I'm going to keep that. Could be something that will later require immediate intervention for, so I'm going to keep that. Now, ecchymosis, right? Ecchymosis area is just bruising. So comparing it's just like a patient that have bruising, right, and a patient that have increased blood pressure. Who is more priority to you? Think about it. Blood pressure, physiological problem, and bruising, just the outer layer of the skin, nothing. Who will be more priority to you? One, obviously, right? So I can easily eliminate two and go to number 3. Now, headache that worsen with coughing. Now, headache is a neurological problem. You understand? Headache is definitely a neurological problem. Even if a patient have increased blood, okay, a patient have hypertension, right? A patient have hypertension. Even if a patient have hypertension and they have headache, guess what? The headache is not a cardiovascular symptom. It just only tell you that the hypertension have stopped affecting the cardiovascular system. It has transferred the problem to the neurological system. That is why the neurological system is also complaining by showing the sign headache. As what I just want to tell you, just in case maybe you say, oh, but a patient with hypertension experience headache. Guess what? You are saying hypertension, but I'm not saying hypertension. I am saying cardiovascular system. Cardiovascular system don't show headache as their sign. They can either show capillary refill problem, pulse problem, low blood pressure, increased blood pressure, arthritis issue. You understand what I'm trying to say? So yeah, but headache is related to neurological problem. So now I have 1 to think about and 3 to think about. Now the last one is also a neurological vital sign, right? Anytime you see vital sign, you need to ask yourself, is it what they call it? Is it normal or abnormal? Like the first one is abnormal, the second one is normal. We want our score to be 13 to 15, so that is normal. So I can easily remove this. Anything lesser than 13 is a problem, so I can easily remove it. So I'm left with 1 and 3. Now this is where I want to reframe your mindset. Now look at number 1 and look at number 3. What do you see in the question? This is where the NCLEX want you to think as a nurse. Now it's easy for you to say, oh, why will a patient with closed head injury develop increased blood pressure? It's easy to say, why would they have headache, and start to be looking at the answers. But the NCLEX don't want you to look at the answer. The NCLEX want you to perceive, right, urgency. Now look at the first option. They said blood pressure of 136/76. And look at option 3. It said headache that worsen with coughing. Meaning this patient already have headache, but now when they cough, the headache, maybe the headache on the scale of 1 to 10, 5. But when they cough, they automatically they complain, right? And they tell you, oh, now I'm experiencing this pain at the level 9/10, 10/10, right? Now it's easy for the NCLEX to just say this patient have what? Headache. It's easy for the NCLEX to just say this patient have headache, right? It's easy for the NCLEX to say that. If the NCLEX just said the patient have headache, I can easily say immediate intervention is 1. But guess what? They said the headache that worsen with coughing. All of a sudden, the patient cough and then the headache worsen. I'm not expecting that, right? So it shows that there's a problem. Now, if one secret I want to let you know, right, on the NCLEX exam is that if there's a symptom, right, there's a sign, there's a symptom, there's a sign, and the NCLEX explain why that symptom is happening, and the NCLEX is not explaining why the other symptom is happening. Pay attention to when the NCLEX explain why that symptom is happening, because right now, it's just right now. Let me just tell you to do something. Cough for me. Cough for me. Do you feel headache? No. So why all of a sudden will someone now cough and start having worsening headache? They did not say they fear headache. Instead, they said worsening headache. It means that naturally you can cough and you don't expect to have headache. But you cough, but this patient is coughing and they are having not only a worsening headache. It shows that is something I need immediate intervention for. Do you understand what I'm saying? Right? It shows that this is what you need immediate intervention for. And if the patient say, okay, headache that was caused due to the condition, we know, okay, it's related to the condition. But right now, coughing is not an expected finding from a neurological problem. Coughing is a respiratory symptom. It's not a neurological symptom. And now you are saying the patient is having headache and a respiratory symptom is affecting more of the headache. It's a problem. Now, this is the reframing that I'm giving to you. And this is the same reframing I give to students in my program that make them pass the NCLEX exam in 85 questions. I have a lot of this kind of way I can make you understand NCLEX question, whereby when you see it, you don't need to be overthinking. You don't need to be thinking about what you've studied about closed-head injury. So far, so good. I've been talking for the last 10 minutes. I have not mentioned anything about closed-head injury. Have I? No. The only thing I've been talking about is just these two things: the disease condition and what? The body system affected. And this, you just need a master class on this. Once you have a master class on this, just go on the NCLEX exam. You are going to exam 85 questions. You walk out of the exam, you feel already that you passed the NCLEX exam. Unlike you before that walk out of the exam and you still feel like you feel worried. You understand? So